Hello and welcome. You're watching NDTV. I'm Rishika Barwa. Dr. Randeep Guleria, the director of the All India Institute of Medical Sciences, joins us. May I also, sir, today introduce you as co-author of the much-awaited book, Till We Win, India's Fight Against the Coronavirus Pandemic. Thanks so much, sir, for being with us. COVID cases in India have crossed the 90 lakh mark. You've said this in your book as well, that India might see multiple peaks.
That's true. So as we go ahead with the pandemic, we will see areas which will show increase in number of cases or peaks, as we're seeing in Delhi right now. So although the overall number of cases has stabilized or is showing a downward trend, there are areas or cities which are showing peaks which are happening because of multiple factors. And that may continue for some more time till we reach a situation where we could say that now there's a sustained decrease in the number of cases. Hopefully, the vaccine will also accelerate that.
Right. But, let's just focus on the deaths at the moment. And the total deaths in Delhi, for instance, have crossed the 8,000 mark. Delhi is suddenly, in the last week, averaging almost 100 deaths a day. Why is Delhi seeing this sharp rise in COVID-19 deaths?
So there is an increase in the number of deaths. There used to be a time when the number of deaths was only around 20 to 30 per day. Now it's really close to 100 per day, although the number of cases have increased. But what we've noticed in the hospital are two things. One is that we are getting more and more sick patients, and especially those with comorbidities. Remember, the winter season and with air pollution, it's not a good time as far as people with chronic diseases are concerned, especially respiratory and heart diseases. And therefore, many individuals who have an underlying heart or lung disease who get COVID-19 have not only a compromised lung function or their basic underlying disease gets compromised. The combination of pollution, cold air and COVID-19 causes them to really have more severe illness, which could also be contributing to the number of deaths. There is a need for all of us to really start doing what we call a death audit to see what are the factors which are contributing to it, and what are the correctable factors that we can bring in place. It could be also late arrival to hospitals or things like that, which we also need to sort of look at. So a death audit needs to be done to see how we can bring down our death rate like what it was in the past.
So is it only factors like air pollution, winter, etc. that have contributed to this? Or, would you say that the infection per se, the virus per se, has become more severe?
I don't think there's enough evidence to say that the virus has mutated and now we are getting more severe illness. Remember, there is, for any illness, there is the vector, which is the virus, the host and the environment. These three factors play a role. So the vector, that is the virus, seems to not have changed much. The environment has changed and the host has also evolved that now the infection is being seen in people with comorbidities and the older age group, which we know are at higher risk. But I think there is a need for us to really look at this. It is a cause of concern because we don't want people should die now when we are talking vaccine being there around the corner.
Okay. And in your book, and since we're talking about morbidities, in your book, you also talk about who is, at risk of developing a severe infection. And in that, you not just talk about comorbidities, but you also talk about gender playing a key role.
Correct. So this is an interesting observation that if you look at even the data, there are more men who die because of COVID-19 as compared to women. And there have been a lot of research going on into this, whether it is hormonal, is it related to the hormones which women have, which actually give them some protection. It is related to the chromosomal X and Y chromosome, which leads to the ACE receptors being differently distributed. So number of factors are there, but this is an observation globally as far as the gender difference is concerned.
Now, the COVID testing, Dr. Guleria, very worryingly dipped drastically in this festive season. Will we see a delayed impact of this dip in testing on the numbers in the coming weeks?
So I think this is a cause of concern, although we've noticed that for the last few months, the testing has been, does dip during the weekend because the number of people who get themselves tested during the weekend does come down and it picks up during the week. But now this time what happened was that along with the weekend we had the festive season, which continued for 3 days. We had Diwali and then we have Bhai Dooj. So because of that, there was a dramatic fall in the number of tests. And we knew that because of the festive season going on in the preceding 1 week, there was a high chance that there would be more cases. So we may see an increase in number of cases in the coming days as a fallout not only of the testing, but because of the fact that we had huge crowds in the market and people were not wearing masks. So I think the next few days till the end of the month are going to be crucial in terms of seeing how the number of cases pan out, not only in Delhi, but in parts of the country also.
And, I know this is an impossible task, but what is the projection for COVID-19 numbers in the coming days, given the fact that we've seen such a dramatic dip in testing?
So this is a tough question because it's difficult to predict.
Yes.
But what I would say is that what we need to focus on is to continue increasing our testing. I think the entire strategy has to be to do more and more tests. I know that with testing, we will pick up more cases, but that will help us to really treat patients early, decrease mortality, and be able to isolate family members and those who have come in close contact so as to prevent the spread of infection.
Well, it's interesting.
So I don't think we should...
Right.
Yes.
No, it's interesting that you talk about, the importance of testing. My question then is, the importance of the right kind of testing, because the Center for Policy Research, for instance, has estimated that due to a disproportionately high antigen testing, and these are their figures as per their own calculations, India could be underreporting almost 20 to 40,000 cases on a daily basis. These are extremely worrying figures. Have we got our testing strategy all wrong, Dr. Guleria?
So I think it's important to understand that this is a question which has been going on for quite some time, the rapid antigen test versus the RT-PCR test. We've always been saying that both of these tests are complementary to each other and don't replace either of the two. And if you have a person who is symptomatic and you feel that he is having COVID-19, if the rapid antigen test is negative, you must do RT-PCR. As a matter of fact, various states have started on a policy that they will take 2 nasal swabs at the same time when they are doing the testing. With the first swab, they'll do the rapid antigen test. If it is positive, the person is treated as positive and the second swab is discarded. On the other hand, if it is negative, the second swab is at the same time sent for RT-PCR so that the patient doesn't have to come again, and that chain of testing of doing the rapid antigen followed by RT-PCR continues. This is a policy that we need to follow because, like you rightly said, it will create a lot of problems if we take patients who have just a negative rapid antigen and say that you don't have COVID-19 when they may actually, it may be actually a false negative test.
Is undetected test therefore, one of the biggest worries right now in India? Undetected cases.
So my concern is, and this is something that we need to really push for, is that there are individuals who have symptoms which are flu-like, which could be because of COVID, but are reluctant to get themselves tested because of multiple reasons. It could be the shopkeeper who feels that if he feels positive, the shop will be shut down. It will affect his day-to-day livelihood. It could be a security guard who may get put off work because of being tested positive, or it could be individuals who are just scared that they may get admitted or the family may get quarantined or isolated because of being positive. I think we have to make people understand that for their own goods and for the good of their other family members, one should not shy away from testing.
Well, absolutely.
What we're noticing is that now many individuals are reluctant to get themselves testing and saying that this is just a seasonal fever and cold that they're having. And that may actually lead to more spread of the infection.
Well, there could be nothing seasonal about that fever, not in the midst of a pandemic. But good news on the vaccine front, Dr. Guleria. Oxford vaccine triggers an immune response, especially in elders. This is good news for India, isn't it?
Yes, I think it's a very exciting time as far as vaccine is concerned, both for the Oxford vaccine and the Moderna vaccine and the Pfizer vaccine. The data is suggested that vaccines do work. We were looking at something like 50% efficacy. We're now looking at over 90% efficacy. We are also seeing that in the elderly, where we were concerned that because in the elderly their immune response is not that strong, we may not get a robust immune response. And in the early days, there was discussion whether we need to give a higher dose of vaccine to the elderly. The results are very, very encouraging. And I think this is great news for all the vaccines which are coming up, because this suggests that we are on the right track in developing a treatment or a proper vaccine as far as COVID-19 is concerned.
So I'm going to ask you the million-dollar question. The vaccine efficacy data as far as India is concerned should be out for the Oxford vaccine in another few weeks. What then, Dr. Guleria, would you state is the timeline for vaccine distribution?
So once the vaccine data is out and the emergency use authorization is given by the UK government, the Indian counterparts will apply for emergency use authorization from the Indian government or the Indian drug controller, and at the same time Indian data to some extent will also be available.
Right.
We already have data as far as safety is concerned, and if the efficacy data is robust and it suggests that it's safe in Indians, then I see that by early next year we should be in a position to roll out the vaccine as far as India is concerned. At least some doses will be available. And I'm aware that the Serum Institute of India and other companies are already in the process of stockpiling the vaccine. So it will be available to be distributed. The government is already working on a detailed plan as far as distribution of the vaccine is concerned, maintaining the cold chain, training people to give the vaccine,
right.
A line listing of who will get the vaccine. So I'm very hopeful that in the first few months of next year, we will start our vaccination program.
All right, that's really good news that you're sharing with us. But you spoke about the Moderna and the Pfizer vaccines, and they've really dominated the news over the last week. But is the Pfizer vaccine, given the logistical challenges, unviable in India, therefore?
So there are logistical challenges as far as the Pfizer vaccine is concerned, considering that it has to be kept at -70°C, and that is not going to be possible. But what I feel is that we will need multiple vaccines to really be able to vaccinate our entire population. And therefore, we will have to see if we have multiple vaccines available, how can we utilize them optimally? So it's possible that we may say that, let's say we have the Pfizer vaccine also available. We may be able to give that vaccine in certain cities where we have facilities for maintaining that temperature. Whereas in smaller cities, we could look at the other vaccine, which has equal efficacy and can be given so that we are able to cover a larger number of our population.
So you're saying
a vaccine strategy will have to be developed over the coming months, depending on the doses that are available and the vaccines that are available in the country, so that we can optimally and as early as possible vaccinate the high-risk groups and those who are likely to be exposed to get the infection.
So it's not just one vaccine, but actually several vaccines that could be disseminated across the country. I think that's a very interesting point that you make. I also want to bring you in, and we've talked about this in previous shows as well. The ICMR now has issued new guidelines for the convalescent plasma therapy. Under what conditions does the plasma therapy work? Because one is seeing that there is a huge spike in demand for convalescent plasma.
So I think it's a very important point because convalescent plasma has been there for more than 100 years. It's been used in a large number of outbreaks and pandemics, and there is data to suggest that it may have some role. As a matter of fact, it gives passive immunity, and if you're looking at the monoclonal antibodies that we're also developing, they also give passive immunity. The issue of convalescent plasma are two. First is that it has to be convalescent plasma which has sufficient amount of antibodies in the plasma, so that it protects the person or gives passive immunity to the person who gets their plasma. We know that COVID-19 is an infection which causes a differential immune response. There are individuals who have very mild illness and recover, but they don't have sufficient antibodies in their blood.
Right.
And giving plasma from them may not be that effective. So whenever we are giving convalescent plasma, the plasma has to be tested properly to make sure that it has sufficient antibodies to be actually protective. So it has to be convalescent plasma, not just plain plasma.
All right. I think
Second important thing is that it has to be given early when the individual who is getting the plasma himself doesn't have enough antibodies, so that this convalescent plasma is useful and really is able to fight the virus and decrease the viral load. Giving it late in the course of the disease when the person's own immune system has already formed antibodies may not be that useful. Well, so the ICMR guidelines are trying to focus on that.
On to our FAQs section. How long do antibodies last in COVID recovered patients, Dr. Guleria, and can a recovered patient be a caregiver for a COVID patient?
Yes. So the first question is, how long do antibodies last? So it's important to understand that this is something that we're still sort of looking at. when we're looking at protection, so it's not only antibodies which give protection, but what we call cell-mediated immunity or T-cell immunity, which also gives protection. And the general feeling now is that antibodies will give you overall protection once you get the infection, whether it be antibody related or T-cell mediated, should last at least 9 months to 1 year. So that is something that is being felt that in general, that is the degree of protection you can get. However, there are very small number of cases who within a few months of having COVID-19 do get reinfection. This is the cause that is being looked at. What is the reason for that? Is there something in the immune system which causes it, or is it infection which causes it? But normally the immunity should last for at least about 9 months or so. Whether a COVID recovered patient can give care, yes, but again he must follow the same protections that one would do otherwise in terms of wearing a mask, hand washing, and maintaining physical distancing as much as possible.
So, you know, in a lot of recovered patients, antibodies don't exist. Many recovered patients don't have any antibodies when they get the test done. Are they still immune therefore?
That's the point, that antibodies alone are not enough to say that you are you don't have any immunity against COVID-19, because we need to really do a more detailed evaluation to see what is the T-cell immunity that these individuals have. Those are more difficult tests to do, and that is why we don't have a large body of data to say what is the degree of immunity that everyone has, even if you don't have antibodies. But limited studies do suggest that even if your antibody titer is low, you still have some degree of protection based on the T-cell immunity which still exists in the body.
Right. So don't be disheartened if you don't have antibodies, basically. Right. Dr. Guleria, in your book, you also talk about something very interesting called, you know, the impact of the coronavirus and how long it lasts. And you call this phenomena the long COVID. Tell us a little more about it.
So what we realize now is that once you recover from COVID, you can still have a large impact of COVID even after you've become COVID-free or you've become non-infectious. And that is what is known as a long COVID or a post-COVID sequelae. So you may continue to have fatigue, body aches. Some patients complain that they're not able to concentrate, what is known as brain fog. And many patients will continue to have what is known as a chronic fatigue syndrome for almost 2 to 3 months. And they would have recovered from COVID, but this phenomena persists for a long period of time, impairing their quality of life. Some patients even have joint pains or backache, and some continue to complain of a dry, irritating cough. As our recovery rate increases, we are now realizing that COVID management doesn't just stop once you become all right and discharged from hospital. In a large number of patients, we need to continue to treat them and follow them up even after they have recovered. Unfortunately, a small number of them have serious problems like lung fibrosis, and they need oxygen at home. We have some patients in our hospital whom we cannot send home for the last 2 months because they are requiring high flow oxygen which cannot be given at home.
Right.
And this is being seen in other hospitals also. So it's a illness that it's a disease that one should be careful about.
And you know, another viewers actually asked this question about long-term scarring of the lungs. What are the indicators? What are the telltale signs?
So the telltale signs are, one is that you find that one is not able to wean off or get off the oxygen that is required, or your oxygen saturation falls significantly when you just take a few steps or go to the toilet, or based on your CT scan, we find that rather than showing what we call the classical feature of an infection, that is ground glassing, it starts showing scarring or features which suggest that this is a part of the lung which has got damaged and scarred rather than having the infection or the inflammation.
Right.
So the CT scan and your need for oxygen on minimal activity or even while you're at rest, even after you have recovered, are the signs which suggest that your lung is significantly compromised.
So then this is a scan perhaps that you recommend all recovered patients should do?
So if you're on recovery, you find that your saturation is falling on even mild activity, and you're having breathlessness even when you walk a few steps with the fall in saturation, you must get your scan done. You must consult your doctor, because then there is a treatment that has to be developed even after you recover.
So very important to be very vigilant of those symptoms even after you've recovered. Another viewer sent a question, what is a cytokine storm and how does it affect a COVID patient?
So what we've realized is that unlike other viral illnesses, especially H1N1, although cytokine storm occurs in other illnesses, even diseases like leptospirosis, When you have, in most patients that we talk of, they have the viral infection, and after about 5 to 7 days, they recover from that and they become all right. 80 to 85% of our individuals we know recover from COVID-19. Usually by the 5th to 7th day, they have no fever, they become all right, and usually they test negative also. Some of them will have lung involvement, which will need oxygen requirement and will need aggressive treatment with steroids, remdesivir, convalescent plasma. But there is a small fraction which go into what is known as cytokine storm, where the body's own system starts overreacting. So when the body sees that there is an infection, it counteracts that with an inflammation.
Right.
But when that inflammation becomes much more, it becomes hyperinflammation. It leads to a cytokine storm, and the body then starts producing a large number of inflammatory markers which start causing, it goes into like a self-destruct phase. And that is a cytokine storm, and that is why in such a situation we give drugs which are like a double-edged sword, because we're trying to decrease this hyperinflammation which has occurred in these small individuals, and that can also be very, very serious.
Well, very interesting. Thanks so much, Dr. Guleria, as always, for sparing your valuable time and answering all our questions. We've tried to answer all the questions, but if you have more, you should definitely pick up a copy of the book that Dr. has authored, Till We Win, India's Fight Against the COVID-19 Pandemic. Thanks so much, Dr. Guleria.
Thank you very much. Thank you.